Um, the reaction to the killing of the United Healthcare executive in Manhattan last month, the collapse of the British and Canadian healthcare systems, the ongoing struggle that so many families have to pay their healthcare, and all underscore sort of the fragility, right, of our systems and the ongoing rage, frustration many folks feel toward healthcare. Senator Murphy, let's start with you. After the killing of Brian Thompson, the chief executive of UnitedHealthcare in Manhattan last month, you noted if this country's leaders don't pay attention to the conversation that's happening right now, this is a mistake. What was the conversation? How would you describe that conversation? And what would you say are at its roots from where you sit?
Well, thanks for having me. Really appreciate it. Yeah, listen, I think our healthcare system is driving Americans mad. I think it's really hard to sort of plumb the depths of that frustration and to understand all of the sources. But you are sort of witnessing a broad-based, growing spiritual unhealth in this country. We have record rates of self-reported unhappiness in America today. We have growing rates of self-harm and addiction, political instability. Very broadly, people are sending us very clear signals that they are upset at the things America values, how hard life is. And given how essential our health is to our well-being, our sense of purpose and meaning, our livelihood, the amount of time we spend thinking about healthcare, the number of people who work in the system, we have to grapple with the fact that at the root of our spiritual unspooling as a nation is likely a healthcare system that is just leaving us super, super angry. And I listen, I think there's lots of reasons for that, but I think at the center of it is this decision we made decades ago that we continue to make, to just care about profit instead of quality, to view our healthcare system as something that should exist for the purposes of making people money. And we don't do that with other sectors of our economy. There are other things that are really important to us that we still value as public goods, right? Elementary education broadly is a thing that some people make money on, but mostly we think of elementary education as just something we do and we provide, and we don't think of it as a source of profit. That's kind of how we thought of healthcare 100 years ago, even 50 years ago, when most of our insurers, for instance, were not for profit, when almost all of our hospitals were not for profit. And over the last 5 decades, we have just turned our healthcare system into something that is blindly, at sometimes, focused on profit-based efficiency. And I'll give you like a small example of how that plays out. And I do not legislate based on personal anecdote, but I of course think about whether my experiences are similar to others, and I think they are. So I've got 2 school-age kids. We've got a pediatric practice that we go to, but we don't have a pediatrician. And the reason for that is that our pediatric practice uses a very efficient system by which we call up and we say we want to come in, and they just match us up. A computer system just matches us up with whatever physician or physician assistant or nurse practitioner is available that day. So every single day we go in, every single time we bring our kid in, it's into a different practitioner. I have no relationship with any pediatrician. I don't know that I get worse care for my kids, but it does leave me feeling a little alone that I don't have one pediatrician that has a relationship with my child. I still remember the name of my pediatrician growing up, Dr. Cartland. He was really important. He was a source of stability and advice for my parents, a source of security for us. The person was, the relationship was. I don't have that with my pediatrician's office. And so I just decided to is there a reason why? And I found out pretty quickly. My pediatrician office is owned in part by Goldman Sachs. My pediatrician is private equity owned. And so they just want to take as much profit as they can out of that system. And one of the ways they do that is to have this first-in-time appointment system where they bill more hours and make more appointments, but never grow relationships. And so that's an example of how we've built a healthcare system that is all about profit maximization that we argue is also in service of patient efficiency, because I do get the appointment quicker than I would if I had to wait for Dr. Cartland to have an opening. But it leaves me as a parent feeling alone, really alone. And I think that it's an example of what is driving people mad. They feel super alone inside our healthcare system. They didn't used to feel that way. Our healthcare system used to actually be a place where sometimes you felt secure. You found relationships, you found sources of stability, and you don't get that anymore.
And I want to talk about the role of private equity and all
Yeah.
third-party players in healthcare. And I think we'll anchor it back in policy around the Affordable Care Act in terms of more modern history and legislation. But first, are you describing in Washington or Connecticut? I'm curious about with your pediatrician.
Well, that's Washington. That's a
Oh,
practice in Washington, but it doesn't matter.
so,
That plays out in
but
all
I
the
know Senator Murphy happened to be a neighbor of mine in Washington, so I know exactly where he's talking about, and I can picture that neighborhood in Northwest Washington. So he's describing that that very much as sort of like a semi-suburban urban area in Washington. Yeah. I can picture it. I can see it. Many of you probably come from places like that too. Many of our students. I would love to hear you respond to that from the perspective of the South Side of Chicago. And working in a large hospital, does what the senator said resonate with you, and same or differently?
Yeah. Well, first of all, thanks for having me. This is an exciting time to talk about these issues because we're no longer under the pressure of an election to create like momentum around an issue. We can talk about it in a little more depth. But what the senator describes is not very dissimilar from what happens here on the South Side of Chicago. I work in an emergency department that is very busy, like emergency departments around the country. One of the reasons for that is calamity falls on all of us like rain. At some point, each of us will find ourselves requiring help on a day that started out normal, when we face one of these before and after moments. And when that occurs, you end up in front of me or one of my colleagues in an emergency department somewhere in this country. And you'll also end up waiting quite some time. I worked in the emergency department last week and took care of somebody who was facing one of these situations where he was having a normal day, he had an accident, he hit his eye, and he came to me with a swollen red eye that he was having trouble seeing out of. It was pretty easy to diagnose. We did a CT scan and found that he had a fracture of his orbit. And with his vision in balance, we consulted the right services in order to get his eye fixed. This is a working person. His eye, there's nothing magical about the eye. Certainly we want to fix his eye, but it wasn't for the sake of fixing his eye. It was to get him back to work, to allow him to see his grandkids, to enjoy his life. But he was still working and had insurance, but he wasn't in network with us. And these networks are created when healthcare insurance and medical centers negotiate prices. And on the day he chose his insurance, he was maybe a consumer, maybe he was a market actor. But on the day he came to me, he was a patient. He was afraid and frustrated and wanted simply to get the care that he needed at the moment that he needed it. Who's to blame on that day? Was it the fact that the medical center and the insurers couldn't come together in order to solve this problem, to get a network broad enough that people likely to need services to get it? Or was it me for not cutting through all of this red tape in order to ensure that he got it today? I certainly didn't want him to get surgery and end up with a hefty bill and end up bankrupted simply because we were going to get this done today. But in the end, I think we're all at fault for this, for accepting this system that too often denies and defers and bankrupts people on the moments that they need care. When you need care, when you're facing a cancer diagnosis, when your vision is in the balance, you don't want market forces defining the value of your life. And it is that which we've decided and accepted over the past however many years. I've been practicing for 25 years. It's been this way the entire time. Despite the fact that I saw the coming of the Affordable Care Act and its implementation, we're no better off when it comes to some of these challenges. And I'm describing somebody with insurance, with good insurance. He was able to get his surgery. Imagine what happens to people who are uninsured, who are on Medicaid, who we've allowed to drop through the cracks, whose eye is just as valuable as people's eyes who have insurance. we actually owe each other something else. And the language of morality isn't captured by the language of capitalism, which is what we're using in order to allocate the resources that define our bodies, our most precious endowments. And so in that room, the patient's trapped. I'm trapped in him, with him. And we're all trapped by these systems that we've agreed to and haven't disrupted over time.
Now, some of these observations could or may sound partisan, and certainly the Affordable Care Act was put together with Democrats only. But there's also some broad agreement across parties or impervious to parties about a lot of these things we're talking about. I think more recently now. I wonder if that's your observation, Senator, there on the Hill. And also, in reference to the Affordable Care Act, that was sort of viewed, at least certainly by mainstream Democrats, as a landmark moment for the industry. Of course, the goal was to insure more people. It wasn't necessarily to address, didn't end up addressing all the systemic issues around insurance and the relationship between providers and insurance. How do you feel, and this is a large question, but kind of focusing on some of the issues that Dr. Fisher raised and that you raised in your experience that you just illuminated with your pediatrician, how has it succeeded in some senses? Obviously, we see that enrollment explodes every time there's an enrollment period for the Affordable Care Act. We surpass, the country surpasses its goals. People who are in states where they're allowed to enroll in the Affordable Care Act do it. So is it successful in that sense that it's insured more people, or do you think it has failed to address some of these issues, even if that wasn't its total design? How are you feeling about it at this point as a lawmaker?
Yeah, I mean, it's just not I don't think it's a cop out to say it's both and, right? I mean, of course, the ACA has saved lives and been a success. 20 plus million people get their insurance. We sort of forget the days where you could be denied insurance because you had a pre-existing condition that doesn't exist any longer. And by the way, the cost curve has been impacted by that law. Cost increases have been lower in the system since we passed that piece of legislation. So I'm proud of it, but it is a creature of an era, right? Of a moment in time when both Democrats and Republicans were enraptured by a neoliberal vision of the economy in which all you needed to do was sort of tweak the market, right? But the market ultimately would solve everything. I'm on the Affordable Care Act. My family is on the Affordable Care Act. So I have to go in and buy a plan every year. I have no fucking idea whether my family's on the right plan. No idea. No idea. I go into that exchange every year and it's like almost like a crapshoot, right? So this idea that the market can work and we're all educated consumers and we're all making the right quality and cost adjusted choice when we're signing up for plans or picking a place to have our surgery. It's just not true inside the healthcare system where we're, often, we don't understand the information or we're making decisions at a moment of crisis where we're, not able to make great consumer decisions. So I do think this is a moment where, we have an opportunity to sort of pull back and say, let's admit that, market principles have failed in many ways to solve problems in the healthcare system. And we may ultimately need a firmer government hand to set rates, to cap prices, to control relationships between players inside the marketplace. So far, that's not a conversation that Republicans are interested in. This is still a pretty partisan fight. Mm-hmm. Like we find narrow areas of agreement on PBM reform or surprise billing. But those are the margins. This is still not an issue that Republicans really want to play in, whether it be adjusting and improving the Affordable Care Act or more rigorous interventions into the broken marketplace.
And we'll talk about the PBMs, the pharmacy benefit managers, at some point, because I think that's something that's actually really important that people don't necessarily know as much about. But I'm curious, Dr. Fisher, you helped prepare for the implementation of the ACA. You helped build these very networks and exchanges for Medicaid members, I think it was, across the states. You went into that role with a provider hat on. Yeah. You came out of it with a provider hat on. Again, responding to what Senator Murphy observes, what do you think?
When I had those roles, I was a younger man, and I went into them relatively naive. I thought that we'd passed this law, we'd clarified a bunch of misunderstandings, because certainly everybody wants, their fellow Americans, other people, to get the right kind of healthcare. And now that we have the laws that define it, this will be easy. We'll just roll this out. Everybody will get better, and it'll be, better quality care at a lower cost. People will get services in the right setting. And I was naive to the level of challenge that there is in creating new systems out of old ones. These are well-trod paths of organizations that have been very successful for decades, doing one thing the same way over and over again, and asking them to pivot into a new way of doing things while discarding their old was an incredible challenge. There's another challenge, which is coming from taking care of patients. I see the sort of vulnerability and intimacy that reveals our shared humanity, the things that are most important to us. And in that setting, it's clear what the stakes are and why we're doing the things that we're doing. When you roll that up into an aggregate at a population level, you often have to translate that into the language of managerial capitalism, of service lines, of quality adjusted life years, of value-based insurance design. And in that, there is no humanity. People get lost. And as a result, many of the decisions that we make also become coarse rather than the sort of fine-grained implementation that's required in order to do the things that we think are most valuable. But it also reminds me that when you're in those roles, you are also somewhat trapped by these systems. When you have to make payroll and you have hundreds or more or thousands of employees, you are also a part of this machine moving forward that you don't want to break or fall apart. You have pressures from your board, from the public markets that also shape these systems of care that are somewhat resistant to change, which is why I think that the ultimate solution is stepping all the way back and not trying to do the same thing that we've been doing, just harder this time or better this time. But thinking about some of the things that the senator mentioned earlier, that we go back to a time where these weren't subject to markets, that we aren't simply using the private markets to adjudicate the things that are most important to us, that we're actually thinking very differently about the way we deliver care and what settings those might be and the resources that we use in order to deliver them. Working within these large systems, you are constrained and often unable to do many of the things that you'd like to do. And everywhere I've been, whether it's in patient care or working in government or working in the private sector, you find a lot of ethical people trying to do the right thing. Almost all of them are frustrated by the incentives that guide the decisions that they're facing. We need new incentives.
So I want to talk about areas of bipartisan compromise, because the fact of the matter is Trump is coming in. You're going to have Republicans controlling the House, narrowly the House and the Senate. One area, it seems to be that there's some broad agreement, correct me if I'm wrong, Senator, is around this issue of pharmacy benefit managers. And I'm obsessed with this issue in part because I don't think people understand how much of a role they play, and because they also represent something else you alluded to at the top of the conversation, which is sort of the role of the invisible middlemen. They're invisible to the patient. They're not invisible to the provider. If you're talking about, whether you're talking about the increasing role of private equity in physician practices, which is true with so many other parts of American life, the pharmacy benefit managers. You've tried to attack this through legislation. I feel like you have been able to work across the aisle on that. Tell us a little bit about third-party middlemen and the roles that they play.
Well, I mean, listen, there has been some interesting avenues of bipartisan cooperation on these PBMs, and they center around making sure that the rebates that are afforded to the PBMs by the pharmaceutical companies are actually passed down to the pharmacies to make sure that they don't end up charging more to the pharmacies than the price that they paid to the company. Obviously, there's real challenges in the vertical integration that exists in the PBM market. There's only a handful of them, and many of them are owned by insurance companies or own insurance companies or own pharmacies or are owned by pharmacies. I think that's a really important avenue. I think PBM reform is often used by the pharmaceutical companies to avoid responsibility. So part of that narrative is driven by the pharmaceutical companies who do not want anybody to talk about the billions of dollars they are pocketing. And while I understand your question, and I think it's always like we always want to look for the hope and the bipartisanship, that is not the story of the next year. The story of the next year is brutal partisanship, right? Is going to be an effort by Republicans to strip bare Medicare and Medicaid, right? The end of last year, Republicans promised to cut Medicare and Medicaid by $2 trillion. That is a fundamentally different Medicare and Medicaid program if you take $2 trillion out of those programs. They have also promised to take money out of the Affordable Care Act. They have put somebody in the FTC who is going to unwind all the progress that Lena Khan made in trying to ask questions about the role of private equity in healthcare. So I get that, like, we want to talk about the very narrow areas of agreement between Republicans and Democrats. But let's remember, Republicans killed the PBM reform at the end of last year. So even the place that we had agreement on at the very last minute, Republicans, I imagine, influenced by the PBMs, came to Democrats and said, we're not even going to do the PBM reform. So I think we are in for a year of brutal, brutal fighting between right and left on Medicare, Medicaid, the Affordable Care Act, the role of private equity in healthcare. And that will be the definition of the next year. I wish I could give you a sunnier picture, but that's just the reality.
Well, I will note President Trump has repeatedly insisted when he campaigned that he didn't want to roll back Medicare. But I want to, before Senator Sanders joins us, I definitely want to make sure that I leave a little bit of time, at least, for students in the room who would like to ask me questions at this juncture of Dr. Fisher and of Senator Murphy, who was going to have to depart in about 5 minutes or so. So I definitely want to give anybody a chance to specifically probably ask him a question. Go ahead. And could identify yourself, please.
Thank you. Hi, my name is Emily. I'm a first year in the college. And just following up, Senator Murphy, on what you just said, we've been talking a lot in recent weeks about how local and state governments are really going to be the bastion of bipartisanship while the federal government is infighting the entire time. And I just wanted to ask if you think the local and state governments have any influence on this topic whatsoever, and if any progress can be made on that level, or do you think it's just going to be stuck in the federal government?
Yeah, I mean, there's states have a lot to say when it comes to the quality of our healthcare system. States can have their own rules about healthcare ownership. In Connecticut, we have very little for-profit ownership of hospitals in Connecticut, because we've just made a decision as a state that we are going to try to keep our inpatient settings in not-for-profit hands. Medicaid systems are run by states, and so states can make the decision to run those systems well or run them very poorly. There are huge differences in healthcare outcomes, life expectancy, infection rates from state to state because of state policy. States can't do much if Medicaid and Medicare are cut to the bone. And despite the fact that Donald Trump said during the campaign that he's not going to cut Medicare, he actually agreed at the end of last year to this deal to target Medicare and Medicaid with $2 trillion worth of cuts. So I think states are absolutely places where you can find agreement, but that progress at the state level becomes very, very hard if ultimately the Republicans push through massive contractions of the programs that help states construct their healthcare systems.
Someone else? Go ahead.
My father is uninsured and he lives in South Texas. So whenever he needs healthcare, he usually goes over the border to Mexico to receive that healthcare. What I'm wondering is, why is there such a massive disparity in the cost of healthcare between two countries? And how does that kind of develop?
Well, and listen, I'm sorry to hear that about your father. Obviously, Texas is one of the states that has not expanded its Medicaid program. So, the Affordable Care Act allowed states to enroll a whole bunch of extra people in Medicaid, and Texas has refused to do that, which means Texas has amongst the highest rates of uninsured in the nation. Listen, the reason why our costs are high are pretty simple. We're one of the only countries in the entire world that doesn't have some kind of process for capping and regulating costs in our healthcare system. Different countries do it different ways, but the United States is one of the only countries that doesn't make a value decision that we should limit the amount of profit that is made. What we have seen as our healthcare economy has gotten deeper and deeper into the hands of the greed-obsessed, profit-obsessed private sector is that costs have gone up and up. So right now, only 4% of physician practices are owned by private equity. But when private equity comes to own a physician group, the costs associated with the care spike almost immediately by 10 to 15%. In nursing homes owned by private equity, the quality goes way down, deaths increase by 10%, costs to the federal government go up. So every time that we sort of plunge the healthcare system deeper and deeper into the hands of people who are motivated only by profit, quality goes down, price goes up. So you can either choose to sort of bring big sections of the healthcare economy back into the hands of nonprofits, that will control costs, or you can just come in and start regulating prices, start capping prices, as we're starting to do with prescription drugs. Those are the kind of things that could get our price structure down.
Did you have anything to add to that particular?
I would just add that that requires some hard choices. It's clear that everything Senator said was correct. When you have private actors who are profit motivated, prices go up. And quality goes down. We've seen that in our nursing homes. We've seen that in our clinical practices. And we're doing more and more privatization. Medicare Advantage is one of these large expansions of the privatization of our public goods, where you again see prices go up and quality goes down. One of the challenges we face are Americans want everything. And if you start to realize that you can't have everything, what are the choices that you start to make? That's when the role of democracy becomes that much more important. Right now, instead of making those choices, if you can afford it, you can have everything you want and even stuff you don't need. And if you can't afford it, you get far less than you require and often end up with a shorter lifespan with more suffering. In the hands of our democracy, where we have public choices about our public resources, we'll begin to start to have to rationalize some of these things along with downward pressure on our prices, but also ensure that everybody gets the things that they need, even if they don't have everything that they want. That kind of conversation needs to be had publicly and not just simply in boardrooms of private equity firms. But everything that Senator Murphy described is correct.
Do we have Senator Sanders here yet or not quite yet? Should we continue with our Q&A, Emma?
I can do one more, but then I got to run.
Okay, one more question for Senator Murphy.
There's some over here.
In the back, please.
Hello, I'm Noah. I'm actually a former Connecticut resident myself, lived in the Guilford area for a long time. Also, just shout out to my mom, who was a pediatrician in Connecticut for 2 decades.
Nice.
So just a question for you. How does the government plan, or you as a lawmaker, plan to address the upcoming shortfall of doctors in our healthcare system across, as it is the government who funds and regulates the number of residency positions open?
Yeah, I mean, listen, this is obviously not a problem exclusive. We have a workforce shortage in almost every sector of the economy right now. So I have this conversation when I talk to the healthcare workforce, the manufacturing workforce. We have a teacher shortage. We have a manufacturing worker shortage. We have a doctor shortage. And so, part of the simple answer here is that you've got to ultimately open up the spigot, allow for immigration to fill many of these roles. And that historically has been a way that we have increased the size of our workforce inside the healthcare system. But it is also true that we are just practicing way too much medicine right now. We are practicing lots of medicine because it ultimately provides profit, but not value added, right? There's all sorts of prescriptions being made that folks don't need, all sorts of surgeries that are in excess that are not necessary for good medicine. You are ultimately going to have to contract utilization to get a system that costs less and a system that delivers better results. And that ultimately may mean that our physician shortage actually isn't as acute as we think it is. So we've got a broad problem when it comes to the amount of workforce that we have and that we need. It's not just exclusive to the healthcare system. My former chairman and ranking member of the Health Committee, is on the line. So I'm going to turn it over to
It's practically a health committee hearing here. Thank you very much, Senator Murphy, for joining us.
Thanks.
It's very wonderful to have you today. Now we will welcome Senator Bernie Sanders, independent from the great state of Vermont, and perhaps more important, an alumni of U Chicago. Served in Congress since 1991, first elected to the Senate in 2006, ranking member still on the Health Committee. He's made affordable health care the center of his political agenda as the nation's loudest champion for Medicare for all, reduced prices, farmers prefer pharmaceutical drugs, landmark bipartisan legislation to address primary care job shortages across the country, and to increase funding across the board for health services in America. Thank you so much for joining us, Senator. Welcome back to campus, sort of.
Thank you very much.
So we were talking quite a bit about the ACA because it seems like a good baseline for where we're at in terms of the health care discussion now. You always, as I recall, saw the Affordable Care Act as sort of an interim step towards single payer. How do you assess it from the position that we're in now?
We got an echo here.
I think it might be.
Okay. Can you hear me okay?
We hear you great.
Okay, well, thanks a lot for having me. Yes, at best, the Affordable Care Act is a bridge. And in my very strong view, we have got to join virtually every other major country on earth and see healthcare as a human right, not a privilege. And to my mind, the best way forward is through what we would call a Medicare for all single payer program. Make Medicare more comprehensive, expand it over a period of 4 or 5 years to every man, woman, and child in this country. Right now, I get around the country and certainly around the state of Vermont. And I almost always, when I make remarks, ask people whether they think the current healthcare system is working. And almost without exception, people do not. They believe that the system is broken. It is dysfunctional. It is extraordinarily complicated. And it is wildly expensive. As I think you probably have discussed, and I agree with much of what Chris Murphy had to say, we are spending twice as much per person on healthcare as virtually any other country on earth. So the fundamental question that we've got to ask ourselves is, how do we spend so much and end up with a system in which 85 million are uninsured or underinsured? And underinsured is a big issue, because if you have a $15,000, $20,000 deductible, you don't go to a doctor when you should. And the result of that is that we have some 60,000 people a year who die because they don't get the medical care they need when they need it. We pay by far the highest prices for prescription drugs. And that means that 1 out of 4 Americans can't afford the prescriptions the doctors prescribe. Now, why is all of that? I mean, the bottom line is the current healthcare system is working extremely well. It's doing exactly what it is supposed to do for the people who own the system. So insurance companies charge you 10 times more for the same exact drug as they'll charge Canadians or Europeans. People in Japan, fine. They're making record-breaking profits. What's the problem? The insurance companies make huge profits, pay their CEOs $30, $40, $50 million a year in salary. They do companies do massive stock buybacks for their investors. What's the problem? Working great. Anyone have a problem with that? And the only problem you might have is if you think that the function of healthcare is not to make huge profits for wealthy people, but to provide quality care for all. And by the way, most Americans believe that. So it's a long answer to a short question, but bottom line is we don't have a healthcare crisis. We have a political crisis. Last night, some of you may have heard President Biden in his farewell address talked about this country moving toward an oligarchy. He is right. You have a government that in no way, shape, or form is about representing ordinary people. It is funded by very powerful special interests, lobbyists all over the place, representing those corporate interests. And it is working. System is working great. Richest people becoming much richer. Corporate profits are soaring. Oh, by the way, our life expectancy is 5 years less than in other countries. If you're working class in this country, you live 7 or 8 years shorter lives than if you're rich. But who cares about that? The function of the system is to make money for people on top, and it's working. The only way it's going to change is when we have a political revolution, when tens of millions of people stand up and say, you know what? Not only do we need a healthcare system that works for all, we need a government that works for all, not just a few. So don't look at healthcare as separate from the climate crisis or many other aspects of our society. The current system is doing phenomenally well for the people on top. That's what it is designed to do. And if your parents die earlier than they should have because they couldn't get to a doctor on time, not their problem. It's your problem. And your job is to figure out a way you can amass the kind of political power we need to change politics in America.
I would like to return to the politics of this in a second, but I do want to pick up on something you said about other countries. We've all seen the struggles of the national health systems in Britain and in Canada. Aren't those, in a sense, cautionary tales for subsidized private insurance? What do we learn from that, these systems that the left have long seen as models?
Well, what you learn is that you had a Conservative Party in the UK in power for many years, underfunding the NHS. You have a Labour Party, which is like the Democratic Party here, corporately dominated. But I would remind you that a few years ago, when the Conservatives were in power in the UK and they held an Olympics in London, I remember, their pride and joy, what they brought forth as something of enormous pride to the British people was their healthcare system. So is it struggling right now? Are there efforts by the oligarchs and the moneyed interests to privatize it, to move toward privatization? It is. But it remains something that the British people are very proud of. And I know that there are many of them who are trying to rebuild it, make it stronger. But at the end of the day, way back in the early 1950s, under the Labour Party in the UK, there was a guy named Nye Bevan. I don't know if that name means to anybody. He was the Minister of Health. And he said something which was very profound, not just for the UK, but I think for the entire world. He said that on a certain day, I don't remember, I think it was in 52, way back when, he said on that day, everybody in the country, you go to any doctor you want, you go to any hospital you want, and you walk in the door and you don't have to pay for it. That was an extraordinary advancement for human civilization. The idea that anybody could get health care. And what happened is people came out of the woodwork. Women who had delayed their own treatments were coming out. People had no teeth in their mouth. They had factories that were running dentures, producing dentures 24/7. People flooding to the doctors because they previously could not afford it. It was an important day for human civilization. And given today, when we are so much richer in this country than the UK was in 1952 after the war, there is no reason other than greed and politics why healthcare should not be a human right for all.
Well, I do want to give Dr. Fisher a chance to either respond to that or even ask a follow-up question of his own, but I just want to ask one thing about that. What evidence, candidly, do you have, sir, that Americans are willing to any more willing than Canadians or Britons, to pay more taxes to fund a system of which you're describing?
Because look, as somebody who's helped lead the effort in this country, ran for president twice on that issue, I know a little bit about the politics of it. And I know about the 30-second ads that were thrown against me and other proponents of Medicare for All. Right now, if you do a poll, and University of Chicago, I think, has polling capabilities, do it. And what you will find is that you ask two questions. Is healthcare a human right? Should be available to all? My guess is 75, 80% of the American people say yes. Now, we did a poll a few months ago. What do you think about Medicare for all? The majority of the people said yes. And that popularity for the program exists when you don't see this issue debated on television. You have never seen a program on television talking about Medicare for all. We're taking on the entire political establishment We're taking on the insurance companies, the drug companies, the Republican Party, much of the Democratic Party. And yet, despite all of that, people understand how profoundly broken the current system is. So you're asking me if we have the opportunity to explain to somebody that yes, you may pay more in taxes depending upon your income. If you're wealthier, you're going to pay a lot more. If you're poor, you're not going to pay any more. But you are not going to pay health insurance premiums. You're not going to have a deductible. You're not going to have a co-payment. Do you think people stay up night saying, oh, I hate paying taxes, but I love paying my health insurance premiums to UnitedHealth or Blue Cross Blue Shield? They don't. Now, we are outgunned on this like 100 to 1. Nobody very few of us talk about it. You have never, and correct me if I'm wrong. Let me ask the students there, faculty, anybody else. Have you ever seen a bloody program on television? One program that says, how does it happen that we spend twice as much per capita on healthcare as other countries and our outcomes are worse? Have you seen one program? CBS, NBC, Fox, you name it.
I think you have
Yet
to ask
despite
about
that-
you have to ask them about YouTube. Doctor,
Yes.
do you have either a response to that or a follow-up for the senator? Before we go to questions soon, I have one more political question I want to ask, and I want to give you all an opportunity to engage with Senator Sanders and, of course, Dr. Fisher.
Yeah.
But I wondered if you had any response to that as a provider.
Well, I think one of the things he said that really resonates is we're the wealthiest nation the world has ever seen, and so we have the capacity to do great things if we so chose. I take care of people who predominantly are Medicaid or uninsured, and many of these insurance issues are sort of foreign to them. They get what they're given. I also take care of patients who reflect in their bodies the legacy of redlining, of predatory mortgages, of discriminatory hiring practices that leave them with a life expectancy here in Inglewood of 59 years compared to 90 years in the Gold Coast, who have the highest blood lead levels in the city are right around this area, and who, when COVID came, were ravaged and died much earlier than those who were able to work from home. And so I guess my question for the senator, and I'm so glad to have this forum with you, is even if we were to do this, what are the other things we would need to do in our society in order to ensure that not just our healthcare was more equitable, but we had different health itself? Those are things that happen where we live, learn, work, and play.
Thank you very much for asking that question. In fact, I just wrote a piece, I don't know where it was, one of the papers on that. And your point is very, very well taken. So let's back it up for a bit. Let's reflect on what the doctor just said. And that is, in the Illinois area, life expectancy varies significantly by income. That what you're saying, doctor?
By income and race.
And race, okay.
And sometimes they're disjointed. People with the same income
Right.
of different races have different health outcomes.
All right, let me focus I've been working on is income. And what I will tell you, and I want you all to reflect upon this, it's not just that we live about 5 years shorter lives as a nation than most of the wealthy countries on earth. That's bad enough. But if you are working class in this country, you will live 7 or 8 years shorter lives than the rich. Now, why is that? Now, that's an extraordinary statement, which is never talked about, or very rarely talked about out of maybe medical circles. Why is that? And it begins to talk about some of the issues that the doctor raised. And that is poorer people, working class people live in unhealthier communities, more pollution. Poorer and working class people cannot afford decent quality food. And we got a food industry that is making billions selling our kids ultra processed food, leading to obesity, leading to diabetes, and other issues. And then there's another factor, and that is the issue of stress. And doctor, you jump in if you think I'm missing something here. But I want you all to think about, and this is, I think, what the doctor is talking about. If tomorrow you had free healthcare for all, which would be fantastic and would save lives right and left, it would not be enough. if you are out there and you're one of the 60% of Americans who are living paycheck to paycheck, you all know what that expression means? I grew up in a family that lived paycheck to paycheck. And what that means, you're working hard, and at the end of the month, you don't have anything in savings for what you have worked. It's just a struggle. And if your landlord raises your rent, you may have to move out of your house. And if your kid gets sick, you really don't know what to do. And if your car breaks down, it's a real crisis because you may not be able to get to work. You can't get to work. You can't get an income. You add all of that and more, you are living under enormous stress. Every single day is a struggle. And doctor, you correct me if I'm wrong, but my understanding is stress has an enormous impact on people's physical and mental health.
Totally agree. And I think that one thing to add to that is the good services and protections that allow for us to stay healthy are not randomly distributed.
Right.
The things that we need, like healthy food and clean air and security from weapons and jobs that nourish and opportunities to thrive, shape our bodies. Stress is one part of that, but anybody who has lived on McDonald's will know that it's not simply stress that makes us decay earlier. And so if we were to wave our magic wand and have a healthcare system that served us all, we would need to do a lot of things in order to reallocate some of these resources that we need to never need healthcare so that we can age gracefully.
Right.
Senator, I want to be able
and
to
that takes you to an economy, by the way, where right now you have tens of millions of people trying to survive on wages of $15, $14 an hour. Mm-hmm. And that leads to stress and all kinds of other unhealthy lifestyles. So the doctor makes a very important point. I mean, let's not minimize the need. If everybody in this country could walk into a doctor's office when he or she needed to, that would be a huge, huge step forward.
I want to be able to go to student questions. I just want to ask you this very quickly. It's really fast, but we've talked about all these different things. Democrats, we know, have done all they can to expand subsidies for insurance purchase, incentivize this is the last states to go into Medicaid under the ACA. The subsidy expansion is about to die. There's certain states that never did accept the ACA. And still, Republicans did clearly win the last election. So why have Democrats not been able to leverage, besides the problem on NBC and people not doing television programs, why have Democrats not been able to leverage this healthcare issue that so animates everybody across party lines?
Well,
Republicans had the last word.
It's a very good question. I think we just went through a presidential campaign where, by and large, healthcare was not discussed terribly much. And where Republicans didn't talk about it, and Democrats said, we are going to protect the Affordable Care Act and try to prevent cuts, rather than say, wait a minute, we got a system that is broken and we need to move towards something much, much better. To answer your question, I think in the world that I live in, which is the United States Senate, if you run for office from the state of Illinois, you're going to have to raise $50–100 million. And you know where that money comes from? It will come from very wealthy, much of that money will come from wealthy and powerful special interests. And you don't bite the hand that feeds you. So it's a corrupt political system, which is in many ways, I'm not saying totally, related to the crisis in healthcare.
I want to make sure students get a chance to ask a question. I think you had your hand up.
Yeah.
Introduce yourself too, please.
So I'm Eduardo. Thank you. So my name is Eduardo. I'm a freshman, and I just arrived here in the U.S. So thank you very much for coming here and discussing this with us. This has the potential to be a very short answer, but I want to ask the question. Do you think you mentioned really briefly the role of, ultra-processed foods and the bad nutrition Americans have, and how that affects the amount of times an American goes to a hospital and that kind of stuff? And so I was wondering if there's room for collaboration between the Democrats and a health department led by RFK, who made a really big part of his campaign saying, "Make America healthy again," and if that could impact health prices long term.
Well, I agree with RFK, just met with him the other day, that our food system is very, very unhealthy. On the other hand, what I'm sorry to have to tell you is that Mr. Kennedy is also a very strong critic of vaccines, which to my mind have saved millions and millions of lives and have said a whole lot of things that are not quite accurate. But I will tell you also that there are Republicans in the Congress who do understand that there's something wrong when so many of our kids and others are overweight, which leads to all sorts of health problems. So disease prevention, keeping people healthy, taking on the food industry to help to demand that they produce healthier food is a very high priority of many of us.
Will you vote for him, Senator, if he comes to the
Pardon
floor?
me?
Will you vote for RFK Jr. if he makes it to the floor?
Well, I'm going to answer the question the way I've answered your question, the way I've answered it to the media. There is a process. We haven't had a hearing yet.
Okay, sir. Question here?
Hi, I'm Davis. I'm a third-year undergrad. I guess my question pertains to the cost of drugs. I'm curious what you think the future might be for some of the IRA provisions like the MD-PNP, or if you think that Biden made a mistake by not necessarily leveraging margin rights effectively to negotiate the cost of drugs even lower, and perhaps how that might flip in a Trump administration.
This is an issue I've worked very hard on. I am proud that we helped lead the effort along with the Biden administration in lowering the cost of asthma for seniors. I'm proud that, lowering the price of insulin for seniors. We have also worked hard with some success in lowering the cost of asthma inhalers, which is a big deal. Put a cap of what seniors will pay for prescription drugs, people on Medicare, at $2,000. And most importantly, and Biden deserves a lot of credit for that, for the first time in history, the United States government will be beginning to do what every other major country does and start negotiating prices. As a matter of fact, tomorrow they're going to list 15 more drugs that they are negotiating prices with. That's the very first time that that has happened. I believe that that will result in significantly lower drug prices over the years. Bottom line, in my view, while I think Biden and his people did more than any other administration in history on this issue. Trump talked about it a whole lot, but he did virtually nothing when he was president. We've got to do a lot more. It is absurd that people are dying or get sick because they cannot afford a drug which might cost 10 times more in this country than it does in other countries. That is absolutely unacceptable. So I would have hoped that the Biden administration would have been even more aggressive, but they do deserve credit for at least beginning to take on a very, very powerful industry, and that is the pharmaceutical companies.
Do we have any questions on this side of the room? Was that in the back there? In the back?
Hi, my name is Janaya. I'm a third-year pre-med and neuroscience student, and this can go for either Dr. Fisher or Senator Bernie. And I was wondering, what is some advice that you would give to like an aspiring physician who's grappling with these political, systemic, and environmental issues? Because of course, as a physician, you're not only treating just the patient, you're treating their mental, physical, emotional well-being, and all these different factors in the external world that goes with that. So I was wondering if you had any advice.
Why don't I start with some of the journey to becoming a physician, which I know is long and arduous, and we need you. Thank you for beginning that journey, because we all need more physicians. We all get sick at some point in time, and I think that to the extent that you maintain your own humanity in the process, you'll be able to see these issues more clearly and become a better advocate, not only for your patients, but for addressing some of these larger systemic issues. I think it requires that you often step back, and much of what we do as physicians is one-on-one. A lot of what we do is hold patients responsible for their care, for showing up, for wearing their masks, for doing all of these individual things, when in fact they're working within a system, within a context that makes them ill, that stands in the way of their care. Maintaining that perspective is going to be important. You're gathering it now, and in college you'll hear more about it in medical school. You'll need peers on your journey to ensure that you all hold each other to account, to ensure that you center the people that you're caring for in that process, and and never blame the victims. And usually it's the person in front of you who is being victimized by systems rather than, if only you had done something different in their care process. So that'd be my advice.
Well, I agree with what Dr. Fisher said, but I would add something to it, not to make your difficult life as a medical student even more difficult. But we need your help. We are right now, I should tell you, mounting a campaign which we'll be working on for the next several months to mobilize people all over the country on a healthcare is a human right campaign. We think there's a lot of support out there if effectively mobilized and organized. And I and other politicians, and there are a number of us who believe in things like Medicare for all, but doctors and nurses are far more effective advocates for Medicare for all than I can be. Because when we have nurses and doctors go forward and say, you know what, I was trained and spent years studying to try to help my patients. And I am functioning in a system where people are walking in the door months after they should have walked in the door, or I cannot prescribe a prescription drug for them because they cannot afford it. Or I have insurance companies leaning over me, telling me what kind of treatment I can provide. We need you to say my job as a physician is to provide the best quality care for all of our people, not to make money for the insurance companies and the drug companies. And I cannot do that job under a current system that is based on greed and is broken. So we need, and we're going out. I mean, there are many, many doctors as an organization called PNHP, Physicians for a National Health Program, and then many, many doctors, a lot of young doctors, nurses, National Nurses Union, largest nurses union in the country, strong advocate for Medicare for all. But we need people in the profession to stand up and say, you know what? I'm proud to be a doctor, I'm proud to be a nurse, but I can't do my job under a broken system.
Senator, do you have time for one more?
One more.
Hi, Senator. Thank you for being here. I'm Jacob. I'm a fourth year here. I wanted to ask you about the cultural reaction we're seeing to Luigi Mangione, because we've seen an outpouring of support for him online, like praising him as a working class hero, and not that everybody who's reacting to this supports murder and condones violence, but I think a lot of people understand the frustration and anger that might led him to do this. So I'm curious, what you make of that reaction from everyday people, but also the reaction from some of your peers in Congress, for instance, who seem to be completely oblivious as to why anybody would be so driven by anger to murder somebody. And Dr. Fisher, feel free to weigh in.
Let's be clear. You're not going to solve the healthcare crisis or any other crisis by shooting somebody in the back, whether it's an insurance executive or anybody else. So I condemn, that act and any other form of violence. But what you have seen online is people's reaction to the health insurance industry, where people have been rejected for claims that they desperately needed. And there is anger against the insurance industry. If you just, it doesn't take, a PhD in economics to figure this out. If the goal of the insurance company is to make as much money as possible, the more claims they reject, the more money they make. And that's what they do. And they use artificial intelligence to help them along their merry way, where they tell doctors what they can do or not, or what drugs they can or cannot prescribe. So I think what that outpouring of anger online showed is the real frustration and disgust that millions of people have with an industry who puts profit over the needs of American patients. So, and I think you're seeing that anger all over the place in many ways. And I think what we've got to do now is not go around killing people. What we've got to do is channel that anger into a political movement which says healthcare is a human right. We're going to do what is not radical. It's what every other major country does. I live 50 miles away from Canada in Burlington, Vermont. Somehow or another, they spend maybe half of what we do, provide healthcare to all of their people. Their system is not perfect, no perfect system on earth, but it is better than ours, and far less expensive than ours.
Well, Senator, it was very generous of you to give a half an hour of your time. We hope you come in person sometime. You're used to the weather here, so that's not an excuse. We love to welcome you back, welcome you to campus in person again, and thank you so much for joining us on this very important question today. Students, Dr. Fisher can probably stick around for a few more if you want to ask some questions. And as usual, we are so glad you came, and we hope you come to all of our events. And our fellows start in a couple weeks, so check out the fellow seminar schedule as well. And thank you again, Senator, for being here.
Thank you all very much.